Hi, I'm George Calixterio, and here is my ID. In this presentation, I'm going to analyze and evaluate the ethical and the legal issues based on a nursing scenario. First, I will detail the clinical case scenario in which a nurse made a serious medical error and hides it to maintain her reputation. I'll identify and explore the ethical and the legal issues, guidelines of the Code of Conduct, Code of Ethics, and Australian legislations will be used for this evaluation, and then I will propose a potential solution to the situation and reflect on my learning from this case study analysis. And finally, I will evaluate three scholarly papers by using a literature matrix. And here's the scenario. Emily is a new graduate nurse providing care to a post-operative patient on a busy shift. As the patient was experiencing pain, she decided to administer analgesic. However, she did not check the medication chart and just administered 5 milligrams of morphine while 500 milligram Panadol was prescribed. And after some time, she noticed that the patient was having respiratory depression and drowsiness. This manifestation made her realize the error. However, due to the fear of facing disciplinary action or reputation loss, she avoided immediate reporting, falsified, and fabricated the documentation. Medical team managed the patient's condition after she called for help. And after investigation, it was discovered that the patient's condition was caused by the medication error, and they also discovered falsified documentation. This scenario presents a significant ethical and legal breaches. In nursing, we mandated to have a solid concept and understanding of ethical principles and laws. Hence, this case evaluation will help me build my critical knowledge that will help me further to promote the quality of my nursing practices in the future. The scenario presents an ethical dilemma for Emily. In this case, she experienced tension between maintaining the quality and safety of care and securing her job as well as her reputation. Various ethical principles were breached. These include professional accountability, integrity, honesty, and the bioethics of non-maleficence. And additionally, the International Council of Nurses Code of Ethics, specifically Principles 2.11 and 2.12, were breached. Emily also breached multiple legal issues by making the medication error, neglecting the patient's safety, and avoiding immediate reporting. She breached the duty of care and conducted negligence. The Code of Conduct Principles 1.3 of mandatory reporting was violated. Principles 2.4 of open disclosure was not observed. She also violated certain sections of the Health Practitioner Regulation National Law Act 2010 of Western Australia, of which I'm going to elaborate in the next slides. Now, let's explore and discuss the ethical issues identified from the previous slides. The fundamental nursing ethics obligate that nurses must be truthful and transparent in their clinical actions and decisions. It promises high quality and reliable care delivery. The ethics of accountability states that nurses must be accountable for their actions and decisions in terms of accurate documentations and appropriate and safe nursing care provisions. In this case, Emily's actions were not honest and accountable, as she masked her error by falsifying documentation and preventing timely reporting. She also failed to attain the ethics of professional integrity because she could not adhere to the expected standards of professional practice, honesty, and accountability. The medication error and negligence resulted in morphine overdose related health impacts, which led to the health deterioration of her patients, and therefore she failed to align with the bioethics of non-maleficence. Let's dig deeper by discussing the Code of Ethics established by International Council of Nurses as a valuable ethical guidelines for nurses. Principles 2.11 of this framework states that nurses must promote ethical conduct when any errors occur. They must ensure patient safety and transparency in their practice. However, Emily did not take any ethical actions after making the medication error. She also avoided making ethical decisions to protect patient safety because she prioritized masking her mistake and instead of attending to her patient's urgent need, such as checking vital signs, since during that time her patient is having respiratory depression. Principle 2.12 states that nurses are accountable for data integrity. However, in this case, Emily fabricated or falsified a medication entry on her documentation and thus breaching this ethical code. As per duty of care in Australia, nurses are legally obligated to deliver a reasonable, high quality and safe care to patients. In this case, Emily did not deliver a safe and high quality care, violating the duty of care. The legal concept of professional negligence indicates a medical malpractice that disrupts patient safety. Emily failed to achieve professionalism as she neglected patient safety and caused professional negligence. NMPA Code of Conduct Principles 1.3 prescribe that nurses must mandatorily report when the patient is at risk. Emily breached this code by avoiding mandatory reporting of the patient's morphine overdose symptoms, which could lead in life-threatening consequences. Principle 2.4 mandates that nurse must openly disclose any patient's safety issue and immediately take necessary actions. And in this case, Emily did not follow this professional conduct. Aside from ethical issues, Emily was also facing legal issues as she breached two sections of the Health Practitioner Regulation National Law of Western Australia. Section 141 obligates that health practitioners should mandatorily notify any patient safety issues in nursing practices. As presented before, Emily did not notify the team about the patient safety issue of morphine overdose immediately. Section 156 of this law also highlighted that practitioners who present false or misleading documents can be legally accused. Emily can face criminal charges, civil lawsuits, and eventually can result to serious legal repercussions that include suspension and even revocation of her nursing registration. Instead of avoiding professional responsibilities, Emily could take immediate patient safety actions to manage the issue of morphine overdose. At first, she should conduct necessary assessments and document findings. Necessary assessments in this case would be taking vital signs, the level of consciousness, and oxygen saturation. The second immediate step would be escalating the issue to the nurse in charge and the medical team to ensure effective risk mitigation without complicating the post-surgical condition of her patient. The next solution would be avoiding any document fabrication or falsification. Instead, Emily could improve her attentiveness, accountability, and documentation skills through continuing professional development. The impact of the ethical and the legal issues could be minimized by acknowledging the error. She should also openly disclose the issue to the healthcare team, to the patients, and to the family members. It could ensure her accountability and professional integrity by showing remorse of her actions, which may be considered favorably by regulatory bodies and employees if the case will be in the court. Moving forward, Emily should cooperate openly during investigation to demonstrate integrity and a willingness to improve, which may influence disciplinary outcomes. She should also undertake remedial education on medication safety, documentation standards, and ethical decision making to demonstrate proactive effort to improve competence and prevent future errors. She should also request supervised practice or mentorship to show commitment to rebuilding trust and ensuring safe practice. If the patient or the family was affected, a sincere apology may be appropriate. Ethical accountability includes acknowledging harm and expressing regret. Avoiding legal charges is not guaranteed, but taking responsibility, showing remorse, and demonstrating a clear plan for improvement can significantly influence the outcomes. Reflecting on my learning, I understood the importance of being attentive to details and accountable while checking medication orders and administering drugs. If only Emily had checked the order and administered the drug accordingly, these ethical and legal issues might not have been occurred. Secondly, I have realized that accurate and honest documentation should be the highest priority of nurses while delivering the care. falsifying documents and masking any errors can lead to ethical breaches and legal consequences. Nurses' ethical responsibilities include accountability, honesty, and integrity. They are responsible to ensure patient safety by following the ethics of the non-maleficence. Additionally, they are obligated to immediately report any patient safety issues or errors to hold legal soundness. Negligence and dishonest documentations are legal breaches. Therefore, nurses must prevent these issues by adhering to nursing ethical and legal principles. Any breaches will ultimately lead to various legal sanctions and charges. This scenario is an eye-opener for me and gave me so much insights to consolidate my learnings. These are the things that I really have to be aware of moving forward as registered nurse in the coming future. Being knowledgeable and abreast of the laws, ethical codes, and nursing standards is a must, as these are considered as the Bible of the nursing profession. In conclusion, the medication errors stemming from inattentiveness, compounded by the delayed response and falsified documentation, resulted in significant patient harm and breaches of both ethical and legal standards. Violation of non-maleficence, accountability, honesty, integrity, duty of care, and professional negligence, along with the infractions of nursing legislations and code of conducts, underscores the severity of the incident. Moving forward, heightened attentiveness, strict adherence to the ethical and the legal standards and guidelines, mandatory reporting, and the transparent disclosures are crucial. Future plans must focus on preventing similar breaches to uphold and maintain the integrity of the nursing practice and, importantly, to ensure the patient safety. And here are my references and my literature matrix. Thank you.